Just spend 20 minutes a week and you will get the body of your dreams. That's the pitch behind EMS, electro muscle stimulation.
2 മണിക്കൂർ ഡെയിലി ജിമ്മിന് വേണ്ടി മാറ്റി വെക്കാനില്ല എന്നുണ്ടെങ്കിൽ ദിസ് ഇസ് എ പെർഫെക്റ്റ് പ്ലേസ്. ആഴ്ചയിൽ വെറും 20 മിനിറ്റ് വരെ വന്ന് വർക്കൗട്ട് ചെയ്താൽ മതി.
So you wear a suit, plug into a machine, your muscles twitch a little, and you are told this is the future of fitness.
Tingling sensation all over your body.
ഇതിന് കിട്ടുന്ന ഈ ടിംഗ്ലിംഗ് സെൻസേഷൻ ഇസ് ബേസിക്കലി നമ്മൾ ജിമ്മിൽ ചെന്ന് വെയിറ്റ് എടുക്കുന്ന കോൺട്രാക്ഷൻ സംഭവിക്കില്ല. ആ സെയിം കോൺട്രാക്ഷൻ വിത്ത് ഇലക്ട്രിക് ഇമ്പൾസ് ഇവിടെ സ്റ്റിമുലേറ്റ് ചെയ്യും.
As a doctor and a lifestyle coach, let's learn with science. Some parts of EMS are real, most are hyped. First, what is this EMS? EMS stands for electrical muscle stimulation. It uses electrical impulses sent through pads or a body suit to make your muscles contract involuntarily. That means it is not under your control. It will feel like tingling or pulsing. Some machines let you move along with it, like squats or arm raises, while wearing the EMS suit. So this EMS is based on a principle called neuromuscular stimulation, which is actually used in physiotherapy and rehabilitation for stroke patients, nerve damage or muscle atrophy patients.
അതുകൊണ്ട് തന്നെ വിത്തൗട്ട് വെയിറ്റ് നിനക്ക് വെയിറ്റ് എടുത്തതിന്റെ എഫേർട്ടും അതിന്റെ റിസൾട്ടും കിട്ടും.
EMS can activate your muscles without needing heavy weights, but that doesn't mean it can replace your strength training or cardio. Second, who can benefit from this? The first category is rehabilitation patients. People who are bedridden, recovering from injuries, or unable to lift weights can benefit. That is where actually EMS shines, helping prevent muscle wasting. And this is supported by a study in physiology done in 2020. Second group of patients, older adults. EMS can help maintain the muscle tone, especially if the joints are weak. This is mentioned in Kemler et al. Strength Conditioning Research Journal 2018. Finding that mild improvements in elderly and untrained population. Third category, elite athletes use EMS as a recovery tool, not as a replacement for their workout. This helps them to reduce soreness, increase blood flow or target specific weak areas. But for healthy, active people and those who are looking to build a real strength or lose fat, EMS is not superior to gym-based training.
ഇത് പെർഫോമൻസ് അത്ലറ്റ്സ് ആണ് കൂടുതൽ യൂസ് ചെയ്തിരുന്നത്. ഇതിപ്പോൾ കോമൺ ആൾക്കാർക്കും യൂസ് ചെയ്യാനുള്ള പോസിബിലിറ്റി.
Now third question, why is this popular? EMS is especially popular in Germany, Austria, Switzerland and some parts of Dubai now. Studios are popping up promising full body workouts in 20 minutes. Even this is happening now in India. For busy professionals, this sounds perfect. No gym, no sweat, no time needed. But that is the actual problem. It sounds like a shortcut, but your body doesn't grow with shortcuts. And the actual truth to this is EMS doesn't load your joints. It doesn't improve your heart function like cardio. It doesn't build resilience. It doesn't build flexibility or balance. At best, it can give mild muscle stimulation, but at worst, it gives people a false sense of progress without real adaptations. Question 4, is it the future of health? Will EMS replace strength training? Never, ever. Not even a chance. Your nervous system, your joints, your ligaments, they all grow stronger only when you move, you lift, push, pull, and you stretch. And this real training is what improves your insulin sensitivity, bone density, testosterone, growth hormone, muscle protein synthesis, brain clarity, and even emotional stability. And don't forget deep sleep, gut health, stress management, and prayer. These are also part of anti-aging formula we teach at Team DoctorBilalFit. We never plug you into machines. We actually plug you into your real health.
കുറേ നാളെ ഒരു പണിയെടുക്കാണ്ട് പെട്ടെന്ന് വർക്കൗട്ട് ചെയ്യുമ്പോൾ ഇറ്റ്സ് ഹാർഡ്. ബട്ട് ഐ തിങ്ക് ജിമ്മിനെക്കാട്ടി ഇറ്റ്സ് ഈസിയർ ആൻഡ് ഓൾസോ യു ക്യാൻ ഡു ഇറ്റ് ഇൻ.
So winding up, can EMS help certain people? Yes, in rehabilitation or busy clients as a minor add-on. But if you want real lifestyle improvement, fat loss, strong muscles, mental clarity, and you want to age gracefully, you need movement, structure, coaching, and a science-backed plan. That's what we clearly do at Team DoctorBilalFit. So don't fall for the hype. Fall in love with the process. Real change never comes in 20 minutes. It comes when you commit daily to becoming the strongest version of yourself. So let's build that together.